Thank you both so much for being with me this morning, and I wanted to ask you, Dr. Hoos, what did you feel were some of the highlights of the IO360 program yesterday?
Yeah, good morning. And yeah, what I can say is the meeting is different than many meetings that we attend. You know, the community has grown very fast, the space has exploded, and we have learned quite a bit since the initial event of ipilimumab approval that started the field. So this meeting has highlighted a few key aspects that we have learned in the last 5 years or so. One of them is that the breadth of modalities, and we had a whole session on different modalities of immunotherapy, is quite broad, and there's a lot we can leverage from that. And that led us actually into a second session about combination therapies. And you know, the maximum value of different modalities will likely come from combining them. So take an example, a checkpoint modulator may combine very nicely with a small molecule that can prime the tumor microenvironment towards the T cell being more active in that environment. So the checkpoint modulator may actually enable the T cell while the small molecule may prime the tumor microenvironment. I mean, this is just one example. The breadth of what we have today is enormous. And there's a lot of opportunity arising from it. What it also does, and I think that was my third message from yesterday, is the complexity that this brings. You know, there are business complexities coming from, you know, the speed and the collaboration that is required in order to bring assets together. But also, and that's actually a very important message, the talent pool of people that can actually deliver these programs is still relatively small because the field is so young. And we learned a lot about how do you retain talent, how you bring talent into new programs that I think is at the heart of delivering the premise of cancer immunotherapy.
Okay, thank you. And Dr. Gulley, in your opinion, what did you feel were some of the highlights of yesterday?
So what I love about this meeting is it brings in people from all groups. So we had people from FDA, from academics, we had biotech, we had pharma, we had Wall Street here, and today we're going to have a patient here too. And so this really brings in a nice session that really covers all the bases, and every stakeholder is here. Yesterday what we saw, I agree with Dr. Hoos that it was fantastic what we saw with the complexity and the possibility with combination therapy. What I also liked, I'm just going to give a specific example. So we've seen that PD-L1 expression appears to be very important in determining who's going to respond to anti-PD-1 and anti-PD-L1 agents. However, this requires biopsy, and if you use tissue from 2 years ago, maybe the tumor microenvironment has changed and maybe it is more inflammatory or less inflammatory. So we saw some early potential for some of the imaging modalities that might be able to see whether these tumors in patients are inflammatory. And if so, it would allow us to not only look at one small tumor, but all the tumors at one time and over time without having to do invasive biopsies. Just one example of the type of technology that's being developed now that offers so much hope.
Excellent. You mentioned combinations. The possibilities seem to be endless. How do we prioritize?
It has to be driven by the science at the end of the day, and you know, by what modalities can actually play together. So science creating mechanism-based hypotheses to combine assets, but then actually testing them in the clinic to see if these combinations are feasible. Because we have already seen with some combinations that are in the clinic that toxicities emerge that need to be managed. In some instances, they're very well manageable. In others, they have led to discontinuation of trials. So some combos will turn out to be feasible, others won't. And we have to learn about that. Not all of it is predictable. So I think these are key aspects that will weed out some of the plethora of different possibilities. And then we will land at what makes the most transformational effect for patients.
Yeah, I imagine this will lead to consolidation in the industry.
Yeah, and I just want to echo what Dr. Hoos said. I completely agree that it needs to be driven by science. And one thing that I just caution, it can't be driven by just what's available on the shelf. It needs to be really thoughtfully looked at and does it make sense to combine this? Is there good rationale for doing this, not just empirically taking drug A plus drug B?
What do you look forward to hearing about today at the conference?
You know, there's so many great things planned for today. I look forward to talks this afternoon that really are by some of the people that were involved in the trials that have changed standard of care. I think that's going to be very fascinating. But I'm also keenly aware of the patient impact, and I really am looking forward to Emily Whitehead's story and how that's going to be shared. That's going to be leading off the session, I think, putting a very nice note on where we all want to go, how we want to be able to take this technology and make an impact on patients' lives.
Okay. And Dr. Hoos, what are you looking forward to today?
Well, the field is, as I said, still very young, but we have made enormous progress in the last few years. So there have been some practice-altering clinical data sets produced that have, in some instances, already led to regulatory approvals of new immunotherapies. They have put us into new patient populations where we didn't even expect that we would see that level of clinical activity. So we will have a session on practice-altering data, which I'm looking very much forward to. It has immediate impact on the patients that we care about. But also, and then another important aspect in that direction, is that we have broken, the tide on treating hematologic malignancies. In the past, people were very skeptical if checkpoint modulators could work in heme malignancies. I think now, from just the middle of last year until now, we've proven that they can. And that data will be shared today, and it'll be quite exciting. It's, again, the other half of the story. Solid tumors we have been treating with immunotherapies for a while. Now we're actually entering hematologic malignancies. And in some ways, when you look at it carefully, we come full circle, because we started in hematologic malignancies with bone marrow transplantation, donor leukocyte infusion, and so on. So it's gratifying to see that.
Okay, I want to thank you both so much, not only for this conversation, but also for leading our program, advising our program, and both Dr. Gulley and Dr. Hoos are the co-chairs of the IO360 event. So thanks so much.
It's an honor to be here. Thank you.